This program is brought to you by the Rollins School of Public Health of Emory University.
Just about every adult in the United States can think of at least one person they love who lost their life to cancer. In my case, it was my grandfather and my aunt. Even today, I have another aunt who continues to battle her ovarian cancer. However, with February being National Cancer Prevention Month, we are reminded that a substantial proportion of cancers are preventable. Many of these cancers are due to overweight or obesity, physical inactivity, and poor nutrition. Other cancers can be prevented through vaccines or the removal of precancerous growths identified through regular screening tests. Early detection of all cancer generally results in better health outcomes. In the United States, cancer is the second most common cause of death. The American Cancer Society reports that 1 in 4 deaths are due to cancer. The cancer sites that contribute to the most death are lung and bronchus, prostate, breast, and colon and rectum. What is striking about many of these cancers is that reducing tobacco use, improving diet and physical activity, reducing obesity, and expanding the use of established screening tests can help prevent them from developing or catch them at earlier, more easily treated stages. I am fortunate to collaborate with talented investigators here in the Rollins School of Public Health on projects that seek to reduce the burden of cancer among underserved populations. First, I serve as co-investigator of the Emory Prevention Research Center under the leadership of Dr. Michelle Kegler in collaboration with the South Georgia Cancer Coalition. Funded by the Centers for Disease Control and Prevention, the Prevention Research Center is dedicated to reducing health risks associated with cancer and other chronic diseases by studying behaviors and environments that support and/or hinder tobacco use, physical activity, and healthy eating. As lead for the Prevention Research Center's Evaluation Corps, I have participated in several efforts to evaluate and/or deliver technical assistance to community-based organizations that are delivering programs that seek to prevent cancer and other chronic diseases. For example, I currently collaborate on the implementation of an evaluation of the Prevention Strategies That Work mini-grants program, which provides funding and technical assistance to faith-based organizations in Southwest Georgia to implement promising organizational policy and environmental changes to promote healthy eating, physical activity, and reduction of secondhand smoke exposure. Also under the umbrella of the Emory Prevention Research Center, I collaborated with a team of investigators on the evaluation of the South Georgia Cancer Coalition's Community Cancer Screening Program. This evaluation focused on the colorectal cancer screening component of the program, in which trained professional health navigators sought to reduce both patient and system-level barriers to colonoscopy screening. This recently completed evaluation found that patients at the clinics in which the program operated were significantly more likely than patients at comparison clinics to undergo colonoscopy screening and be guideline compliant on at least one colorectal cancer screening test, such as sigmoidoscopy or fecal occult blood test. These findings, which will be published in an upcoming issue of the journal Cancer, offer some support for the use of patient navigation for improving access to colonoscopy screening among low-income adults in a rural setting. In a separate line of work, I serve as principal investigator of a patient navigation program funded by the Avon Foundation Breast Cancer Crusade. This project seeks to improve access to breast cancer screening, treatment, and care among underserved, uninsured, and underinsured women here in Atlanta. The projects that I just described represent efforts to impact individuals and their social environments in ways that prevent cancer at multiple levels of the prevention spectrum. Out of recognition of the millions of Americans who battle cancer daily, I hope that you will take this opportunity to identify specific ways in which you can make changes to your own lifestyle and possibly even to your family and social environment to reduce the risk of cancer. Here at the Rollins School of Public Health, we are committed to partnering with you on this endeavor through scientifically rigorous research that informs best practices in chronic disease prevention.
The preceding program is copyrighted by the Rollins School of Public Health of Emory University.